most famous physical therapist on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Together we are
therapist.
the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to show you the top 3 things you should try before knee surgery or replacement. Plus, it's a giveaway day, Brad.
Okay, then.
To start our giveaway, if you are new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Go to bobandbrad.com for the giveaway, which will just be starting. Go to the giveaway section. This week we're giving away a knee glide, which we're going to show you later on, Brad. We're going to show them how to use this. You can also find it on Facebook. It'll be pinned to the top of the page, the contest that is. Go to Twitter, Instagram, or TikTok if you want a 60-second version of our program.
Okay, 60 seconds.
All right, so let's first talk about, let's say you're having trouble with your cartilage or your meniscus in your knee, and they're talking about surgery. The latest recommendations are, and this is pretty solid sources that I see this recommended again and again, is they would not recommend having any meniscus repair unless the knee is locking on you.
Which means if you've had this, you know, because the knee will lock, and it's not only locks, but it's typically quite painful.
Right.
And then you have to work it around a little bit. Then the meniscus fold opens up, and then it's okay again.
Yeah, the idea is that if you have surgery on a meniscus repair and it's not locking, what they're finding is that like 6 months later, you're in the same position that you would have been if you wouldn't have had the surgery.
Sure.
So the surgery really is not, you know, you're putting yourself at risk, even though it's minimal risk, for really all for naught. There's really not much to be gained.
Right.
So we're going to have you try these things first. Now, if you're going to have full-blown knee replacement, in that case, I want you to try these things first to see if you can put it off a little bit. Knee replacements tend to last about 20 years.
Right.
And so if you are younger, you know, by younger, when we say younger, now it's anybody lower than 60.
Right.
You know, you want to make sure you get a good 20 years out, but I don't want you limping around and not being able to sleep with knee pain. So,
but actually, if you are going to have a knee replacement, the better your range of motion is before going into surgery, the better the rehab comes out.
The better
faster.
the strength too.
Right.
So all these things will help you no matter if you are going to have the surgery or not.
Right.
So the first thing I try to tell people, try to calm the knee pain down. Knee pain and arthritis, whatever you have, tends to flare up and it tends to calm down. And if you're in a flare up, you're going to be thinking, wow, this is so bad, I need to have surgery. But try these few things first to get it to calm down. The first thing we recommend is use a walking aid. And this is the one that people chafe against a lot. They'll
chafe?
Yep. They say, yeah, I'm not going to be using a walking aid.
Yeah.
So what's funny to me, though, is that a lot of people, got me, Mike? A lot of people will walk around like this and they think, you know, that a walking aid is going to draw attention to them.
So he's talking about a cane, typically?
Yeah, but believe me, you're drawing attention to yourself already because you're really limping. So, yeah, what we have here, I thought we'd just mention this, Brad. They sent these are really nice. The Prime Stick Dynamo, really a nice walking stick. It looks a little sportier, too. It doesn't look like a cane.
Yeah, so you're going to be on the in. And they're nice and adjustable here.
Yeah, and they're lightweight. They got good tips on them. We'll put a link below. Okay. It was a nice company. They sent us some. And what I like about it, too, it's a lot easier to keep your posture, Brad.
Right. Yeah, it's up higher.
Yeah, you're not leaning
promotes
forward.
that.
Yeah, so use you know, my wife went through a bout of knee pain, really bad. And to the point, she first said, there's no way I'm using a cane. By the end, she was using crutches. We had her on double crutches.
But she'd rather have crutches than the cane.
Right.
Crutches.
Right.
Better appearance for some people.
Right, for some that are young. Yeah. And she used the crutches for a while. We did some other things, and she's back to running.
Yeah, I just saw her running the other day.
Yeah. So you know, if you can calm that knee pain down, somebody, you know, if she wasn't married to a therapist, she might have had surgery by now. So, you know, I'm serious.
Well, no, I agree, Bob.
Why do you have that look on your face?
I thought I could come up with something on that one, but I couldn't.
So you also may try some medications,
right.
Some anti-inflammatory medications recommended by your doctor or pharmacist. like ibuprofen.
Yeah, some across the counter.
Yeah. The other also one you do is you want to decrease your load-bearing activities. What I mean by that is decrease the amount of kneeling you are doing. You know, especially I had just had a nurse that was doing this. He goes, I sit like this a lot.
Yeah.
I'm like, and you're wondering why you have knee pain?
What do you mean sits like that a lot?
I mean, he gets in that position a lot.
Oh, like for gardening
Yeah,
or whatever.
yeah.
Mm-hmm.
So, and that's what I'm saying. If my sister just went through a bout of knee pain, and she couldn't figure out why it started. And I go, "What'd you do last weekend?" Well, I gardened all weekend, and she just made no correlation between that.
Right.
She stopped gardening for a couple of weeks, or just a weekend even, and her knee pain calmed right down again.
Sure.
So you want to avoid stairs if you can. You want to avoid hills if you can. I know you can't completely, baby,
Right.
but you can.
One thing on steps I've done with a lot of patients is I just tell them take one step at a time.
Sure.
Use the good leg going up, and then when you go down, lead with the sore knee.
Yep.
Takes a lot of stress off the knees.
Yep. Uneven ground too is really hard on
Yeah,
bad knees.
Exactly.
So all these things, do it for a while. I'm not saying do it forever. I'm just saying do it till it calms down, and then we'll see how it goes.
Sure.
So a couple stretches that seem to really help. You got that stool over there, Brad, don't you?
I do, Bob.
If your knee is lacking the bend, or it's not going as straight as the other one, and it's very easy to test this. All you do is put both legs up like this and let them straighten out. And I got to get to the edge of the chair, Brad.
Yeah.
I'll probably show from the side here like this. Now, if you put up one and you can see it's bent a little bit, you put up the other one and it goes right down. It'll probably be better that way.
Yep. So they can.
This one's
see
bent a
what's
little bit.
going on
This
there.
one's lacking extension. If you can regain that extension quite often, it lowers the amount of pain you're having in the knee, believe it or not. And we've seen this happen time and time again. So what you're going to do is you're going to put your foot up on a stool. Sometimes people even just do it on the floor.
You can.
And you're going to go pressure on. You can put one hand above and below, or you can put right above,
So
not on the knee.
Right, the kneecap especially.
Yeah. So you're doing pressure on, pressure off. The reason we say those words, that's how long we want you to push.
Right.
Pressure on, pressure off. Pressure on, pressure off. Now you can do that throughout the day.
We do it 5 to 10 times.
Sure. Every hour.
Yep.
As much as possible. Little variations on this. Some people have a little more success if they turn their foot out like this and then do pressure on.
Sure.
That's how my wife's, that's just she responded to.
Toe out.
Toe out, yep. She used to even do it on the couch. She'd lay on the couch, she'd watch TV, and she'd put the foot up on the foot.
Yeah.
On the,
You never helped.
No, I did some things.
You did?
Yeah, I did
you
some
watched
manual
TV,
things.
I suppose.
Yeah, I watched TV. I told her what was on TV. No, you turn your foot in and try it that way
Sure.
too.
Yep.
So you can also work on knee flexion. And I'm going to simply just show you this way, Brad. You can just grab near the lower, close to the ankle, and pressure on, pressure off. Pressure on, pressure off.
Sometimes I've had people have better success up closer to the knee. It just changes the force of where the joint is
Which
articulating.
made me think, do you want to grab that towel, Brad, real quick? I'm going to show a McKenzie maneuver.
Oh, yes. This one.
Yeah, they recommend this too. Sometimes to help with the knee bending, you actually put a towel underneath the knee like this, and it gaps the knee a little bit.
So the towel's rolled up, and
it's rolled up underneath the knee, and you do the same thing: pressure on, pressure off.
So it's right up in the crux of the knee. Yep.
Yeah. So the last recommendation we're going to make is try some unweighted movement. So what do we mean by that? We mean like a bicycle where you're really not putting weight on the knee, but you're getting movement.
Sure.
The other thing is this week's giveaway, the knee glide. So this is used quite often for people after they've had surgery.
Or even before.
And the idea is that you can get movement in your knee without weight on the knee.
Right.
So I can just go ahead. It works just really easily. It's very portable. This thing weighs less than 5 pounds, right, Brad?
It's 3.1.
3.1 pounds. And what's nice about it, the stand makes it at a better angle, but you can also do it flat. And you can also do it with the stand on this side close to me. So then you're working the hamstring a little bit more.
Right. It's amazing what the incline makes a difference one way or the other, particularly after surgery.
Right.
Then it's really noticeable. I do have to mention, Bob, I just had a friend of mine had a heart attack. Went in. Luckily, they saved him. They put a stent in. He full recovery, but he laid on the bed for about a day and a half during, right after surgery, and they didn't want him to move. They had because they went in for the stent into the femoral crease.
Right.
So he couldn't move that leg, and he has a tendency to have arthritic knees, and that non-movement got his knees so stiff. I brought him one of these because he was trying to get it to move. I says, I got just a thing
nice
for
friend.
Yeah, so I brought this, and he texted me back, it works. And it was only about a week or so, and his knee got back, and he gave it back to me. But
I think this is a surprise to many people out there. You think that, well, it's going to feel better because I'm not moving it.
Right.
But actually, knee pain. I remember a study from when I was in school, Brad.
Yes.
150 years ago. That they did a study on little rabbits. And the rabbits had arthritis.
Yep.
And half the rabbits, they had them on a motion, moving them.
Mm-hmm.
And the other half, they let it rest. And the ones that rested got worse. The knee pain.
Did they ask him if they had arthritis or what?
Yeah, the bunny said, "Oh,
got arthritis."
Yeah.
Some of those studies are amazing.
Yeah, I don't know how they found all the rabbits that have arthritis. We're looking for rabbits with arthritis. Could you join our study? So anyway, we got off tangent a little. And a bike will also work for that, but it's just a great way to start getting some smoothness to that knee.
Right.
Give it a try. Give it like 15, 20 minutes a day. You could even work up to on that.
Right.
So
in this case, it's like he's laying in bed just for a day and a half, but it was like the knee got rusty and it just locked up, and then we just had to break.
This works well in bed.
Yeah,
I'm always surprised how
there's
well
no
it works.
reason why you cannot use that in bed or right after surgery in the hospital bed.
All right. Thanks everybody for watching. Appreciate it.